Hello, my name is Tony Green, and I will be talking about healthcare delivery systems. Okay, let's begin. Healthcare systems. The healthcare system includes, the healthcare delivery system includes providers, settings, insurance companies, and patients. The patients are involved. They have the right, to determine their own care and make input to aid in getting high quality care from providers. All the parts of the healthcare system work together to create the healthcare delivery system. Okay, let's talk about providers first. To begin with, providers include physicians, dentists, pharmacists, therapists, nurses, allied health services, and chaplains. What they do. So, providers provide a service. To be more specific, physicians diagnose and treat various medical conditions. They play a critical role in patient care. However, access to doctors can be limited in rural areas for individuals facing financial or insurance barriers. Dentists focus on teeth and gum health, but the cost of dental care could be expensive, especially for those with limited insurance coverage. Pharmacists are responsible for dispensing medications and providing instructions on their proper use. The high cost of medications, coupled with significant copays, can be a financial burden for many patients. Therapists provide support for physical, occupational, and mental health needs. Unfortunately, there are gaps in the mental health coverage, often limited access to essential care. Nurses offer direct patient care and are instrumental in educating patients about their health. However, the widespread nursing shortages and burnout have a negative impact on the quality of care. Allied health professionals include technicians, radiologists, and other support staff. They all play a major role in healthcare. Health service administrators are important as well because they oversee management of healthcare facilities. And the chaplains provide spiritual support within healthcare settings, contributing to the emotional and spiritual well-being of patients. Okay, let's talk about how each one create or address inequality in healthcare. I kind of talked about it on the last slide as well, but the major themes that I found was availability, communication, quality of care, and cost. So the common thing among them all, like I said, was the availability, communication, quality of care, and cost. Addressing inequalities and striving for patient-centered care begins with communication, and it involves the patient. Effective communication between physicians and patients can serve as a turning point in care, according to Vail 2022. There's research that found that patients who reported better communication with their providers felt more empowered and involved in their care, leading to increased satisfaction with their healthcare experience. Availability of providers can also vary, so that's another problem, which directly influences the quality of care. This is particularly evident in rural areas where specialties may be limited. The United States has attempted to address this by employing nurse practitioners, welcoming foreign doctors, and providing incentives to encourage healthcare professionals to work in those underserved areas. Effective management also plays a critical role in the care delivery. Poor management often results in delay and insufficiencies, while well-structured management can enhance care. Additionally, patients who have longer hospital stays are more likely to seek chaplain service, which can aid in improving their overall quality of health. Finally, healthcare workers suggest that improving communication by using simpler language and clearly explaining medical information could significantly enhance patient understanding and involvement. When it comes to costs, there's insurance restrictions can limit patient access, and some offices may overcharge for certain services. This is because some governments pay private healthcare providers a fixed amount for each patient or for each service, like in the case of doctor visits or surgery. Okay, next is settings. Settings includes hospitals, nursing care facilities, mental health institutions, outpatient facilities, community health centers, um, mental health centers, school clinics, uh, physician offices, and laboratories. So there are a great variety of healthcare settings. How do each one create or address inequality in healthcare? So hospitals provide emergency and specialized care, serving as critical healthcare centers, especially for those low-income individuals. However, rural areas often have fewer hospitals, limiting access for those populations. Nursing care facilities offer long-term care for individuals with chronic illnesses or disabilities, but the high cost of these services can be a significant financial burden. Mental health institutes are designed to treat individuals with mental health disorders. Unfortunately, a lack of adequate insurance coverage often reduces access to necessary mental health care. Moreover, outpatient facilities offer the same day treatments without overnight stays, while inpatient require longer stays, like in those hospital settings. Community health centers help serve the underserved population. And like example would be like the health unit, and they play a direct role in helping low income or uninsured patients access essential services. School clinics provide healthcare services to students. The problem is that all schools may not have a clinic. Private doctor offices offer both primary and specialized care. Laboratories, they diagnose tests and they are essential for healthcare. The common theme among these healthcare settings include availability, cost, and patient education. When it comes to setting, education needs to be put in place. One study found that wealthier people were more likely to visit general doctors and specialized doctors than low income people, even if they needed the same amount of care. Yet low income people were more likely to go to the hospital than wealthier people. So they basically need to be educated on where to go, cause it's like wasting money for them to be going to the hospital when they could just go to like an urgent care. It's also like wasting resources as well. So they should be educated, and they probably will receive better quality of care because they're in the right place. Okay, the next thing we're going to talk about is purchasers. This is your insurance, government, and individuals. This could be your public or private insurance, which could be Medicaid, Medicare, private insurance companies, or employee-based insurance. All right. So again, to be exact, that's our public and private insurances. Um Public insurance, while providing essential coverage, can sometimes result in lower quality of care. Medicaid offers health insurance for low-income individuals, but although it covers a large population, a problem is not all healthcare providers accept them, so they have limited access to services. Medicare provider insurance is for people 65 and older, as well as those who are disabled. While it supports the elderly, there's still gaps in the coverage, and they can be left with needs unmet. The American Care Act was put into place to help compensate for the gaps, yet the system isn't as perfect as people want it to be. It still needs improvement. Gaps still exist. Insufficient government payments may result in low quality of care because they know that the government is only paying a set amount, so they may not give the best care as if somebody was paying with private insurance. Another issue is like with overpayment. Um, Overpayment from that public insurance or from government could lead to fraud and like just poor management. Private insurance, which can be purchased individually or through employers, often come with high costs and limited provider networks, making it difficult for some to access the care they need. Employee-based insurance, which is offered as a benefit by many employers, typically provide good coverage for employees, but not all jobs offer insurance, leaving some people without access. Okay, that is the end of my presentation. In conclusion, the healthcare system is made of several different parts. To summarize, it includes providers, settings, and purchasers, as well as individuals. And without each component working together, there would be no system. Thank you all for listening.